the day before Thanksgiving. I know not only are we busy still, but minds might wander a little bit into Thanksgiving. So we'll try to make this valuable. Always our goal for NAM, ever since we started the program and working with them back in 2003, was to bring value to all of you, kind of regardless of size. One of the comments I'll make is the dynamics of the nonprofit association are many, right? There's small nonprofits, there's large nonprofits, all in a number of different industries within those nonprofit codes. So that has always created some of its own nuances and challenges for healthcare. Um, Healthcare remains at the top of everybody's list, probably second largest expense besides your payroll. And our goal is obviously to keep that under control as much as possible. So we wanted to give you a little bit of a sense, where is the marketplace? What does all this mean? What are all the discussions? Try to help you make some thoughts, give some direction potentially for your considerations as we look at a little bit of a PowerPoint we went together on. What I'd like to do is make sure this meeting is for you. Corey and I will try to watch the chat as well, but if you have a question and you want to jump in, then certainly give us a shout, and we'll try to pause and cover what's going on out there. So, and happy to help you as we get to the year end here. Corey, I don't know if there was any other thoughts before I jump in.
Let's kick it off.
Hopefully you'll see the PowerPoint and not my calendar or something like that. Good. So the first couple pages here will move along fairly quick. I think what we wanted to do is talk about challenges, some of the market solutions that are out there, give all of you kind of a chance to maybe even weigh in a little bit as to what you're seeing. But as we look at what are the renewals out there and what are the struggles that we've all faced, I would tell you 2026 renewals are the highest in roughly 15 years, if not longer. Certainly, it's been one of the more difficult years in my career with the sheer number of employers that are getting major increases out there. So driving difficult decisions for many of you and many businesses in general. I will tell you, Blue Cross has averaged in their fully insured renewals 23% that they announced. The ACA markets for small employers under 50 employees was double digits, somewhere around the 15 to 16% range. Mid-market employers, 50 to 500, also have seen double-digit increases. Large employers, defined as those greater than 500 employees, also were double digits. They have been able to buy down with some benefit changes. So if you read any of the national periodicals, Wall Street, that sort of thing, they're going to tell you after benefit changes, it's going to be around a 9% increase this year. The individual marketplace is up over 20%. One of the carriers in Nebraska announced a 40% increase. Many of the associations out there have announced multiple years now of double-digit increases. I'll tell you, the NAM program, we have two pieces of this that I'll get into in a little bit, but We offer a plan that's called level funding. It basically looks like fully insured, but there is a refund capability to it. We announced an 8% rate increase for 2026. So we were extremely happy with that. Blue Cross mentioned that that was the lowest increase that they've given out this year. We think we still face some of the challenges, but with the size of our program and the structure of that program, it has performed extremely well. Uh, we've had to go through multiple changes in the market over the time frame since 2003, but I think we've accomplished that. Couple things that we're seeing though is employee out of pockets have reached limits of what we've heard and said as no coverage. So do the employees feel that even if they're buying insurance, that if they get sick, they can afford the claims that they're owed? And I put in a couple of details there. The ACA now allows the maximum single out of pocket at $10,600. And if you have family coverage, $21,200. Don't know, but I think all of us would say if we got really sick and had to come up with $21,000, that would be almost an impossible task for us. So one of our goals also is to balance the affordability of the premium with the affordability of getting sick. So in our programs, we have managed to much lower out-of-pocket maximums than these in order to make it and continue to be affordable. So with those renewals, first of all, what's driving it? I get that question from all of our customers, so I'm sure that comes to mind for all of you. What is really behind all these significant increases? And in the medical side of things, there's two factors. There's a lot more, but there's two main factors. One is how much are we consuming as individuals each year? And that is up over 5%. And this has been compounding for a while. So our consumption is going up, but also the unit cost. So a day in the hospital or a day at the doctor's office or that prescription, those unit costs are going up significantly, but averaging over 8%. So you combine those two and you're up over a 13% year over year cost. So that is how the cost has increased. But when we look at claim costs, and I'll jump down to the bottom, I think first thing is important to understand that a dollar of premium is broken up really into two different categories. There's administration costs, 15%, and then everything else goes to pay the claims that you and I have. When we look at how is healthcare divided today, and I'll give you a little bit of history there, but large claimants, when we look at a group of, let's just say 100 people, there'll be approximately 7 of us that will have a large claim. And 7 of us then, if you look at all the claims for that group, will consume 75% of all the claims paid. That number has always been staggering to me, but what it means is that very few of us get really, really sick. And when we get really, really sick, all the premiums combined aren't enough to pay for those claims. Um, so within that, what's further going on is we see chronic conditions are driving healthcare. As we're aging, there's more chronic conditions, and there's comorbidities or multiple complications. So diabetes and heart conditions, for instance, many times go together. Pharmacy costs are jumping extremely, and I think there's been a lot of press around that. I'll try to give you a little bit of a picture of that. Well, one thing that most of our employers do and members of the plan, you guys included, you use generic drugs almost always when it's available. And you can see 90% of the time you're filling a generic drug, and that costs you $10, costs the plan $20, so you share that. But when we start to get brand name drugs and specialty drugs, kind of the same thing that's going on in medical is very few of us consume a lot. Specialty drugs, and those are the ones you see on TV. Frankly, they're advertising all the time. Skyrizi, Stellara, Humira, all those things. Those are on average 8,000 a month, so almost 100,000. But autoimmune system has been jumping significantly, and that's a lot of that is like psoriasis. There's many other diseases that we would throw into autoimmune, Crohn's, IBD, but those prescriptions now are over 20,000 a month. So you're talking almost $250,000 for a prescription. That's what's driving healthcare. And I think expectations are high that the plans all cover everything, everything that we would need and want under healthcare. But that is why healthcare is so expensive. Let me pause there for just a second and just see if anybody has a driving question around that. And then we're going to talk about thoughts around how our employers are dealing with that. I'll see. Is there anything in the chat, Corey?
Yes, you said the ACA allows maximum out of pocket for single 10,600, family 21,200. Um, what does that mean? Does that mean all policies are going to have that, or is it just, I mean, I know it says
That's
ACA.
Yeah, that's a good question. No, that's the maximum. So that would be like a bronze plan in the market. You still have some of the carriers will offer platinum, which is lower, gold, and silver. Silver is the one that really almost 90% of the employers are buying silver plans today. Most of us have found that gold level plans and platinum level plans for sure have not met anything that's affordable for most employers. So when we say silver, you're approaching, so 90% of the employers out there are approaching those maximum out of pockets with the plans that they're buying today. Thank you for that question.
Thank you for the answer.
When we look at, okay, so let's say that you were delivered one of these 23% rate increases. And then a lot of questions is, well, how are we going to deal with this? What can we do? So we shop the market, right? We try to see is Blues or Medica or United Healthcare, Aetna really an answer to that. But generally, the first thing is we start talking about plan design changes. And as we've all raised our deductibles and our copays and out of pockets, typically now we're only finding, 1 to 3% differences in plan design unless you're really making major changes. But even then, you might only get 7 to 10%. So now you cut your renewal in half, but you're delivering a tough message to the employees about what premiums are going to have to do. And I would say since COVID, employers have really tried to absorb a lot of the increase and not pass it on to the employees. We are seeing this year more employers in a position they have to. So 2026 messages have been a little bit harder to deliver.
Jim, I would add to that, just we didn't have necessarily a bullet on that, but one thought that came to mind is the discussion around networks and the narrow networks that are often offered by the various carriers out there. And so employers have looked at a strategy to perhaps offer employees different options of networks that are available that can also sometimes cut the cost or move the premium somewhere in the neighborhood of 10% sometimes to offer those narrower hospital networks that are available with the various carriers.
Yeah, that's a great point. So when we look at what's available in the market, I know many of the smaller agencies have tried to provide a stipend to individuals to buy in the individual market. Uh, there's 5 carriers today, so there's been some expansion with competition in the individual market: Blue Cross, Medica, United Healthcare, AM Better, Oscar. Um, on the group side, primarily there's 4 insurance carriers: Blue Cross, United, Medica, Aetna, and then Nationwide has a small amount of business, but they're out there as well. When we look at those, what is the barrier? For instance, why is Cigna, one of the major ones, not in Nebraska? And I would tell you, the insurance carriers would all love to come to Nebraska, but the providers, the doctors and hospitals, kind of control that by what PPO discount they're going to allow um, as they come into the state. And for whatever reason, Cigna has not been successful at negotiating with the hospitals and doctors in our market. So they're a major player in Kansas market, Kansas City, but we don't see them here. We've looked at fully insured, and then there's 2 other concepts that are there. There is level funded coverage. Uh, we'll talk about that. And then there's true self-funded for those of you that are a little bit larger, generally over 100 employees. We would typically say can look at the self-funding options. And then there's a relatively new topic of discussion out there called ICRAs, which is individual coverage HRA, or health reimbursement arrangement. Uh, there's some of them, there's a number of them around the country. Here's a few of those by name. Blue Cross started one this year for 2026. Gravy was one of the first ones in the market. Bavy was developed by Milliman, an actuarial company. Remodel Health is a little bit newer option, and others. The concept for ICRA is that it is an alternative now for employers. So if you cannot afford your group insurance contract, it allows you as an alternative to the group market to provide money to the employees to purchase individual coverage in the marketplace. There's a lot of technical aspects to it, and I'll just say it was designed originally for employers over 50 lives, where they had the federal mandate, that they had to offer health insurance coverage. It had to meet minimum value of the plan, and it had to meet affordability to the employee. So those 3 things combined, well, Congress said, okay, we'll allow the employers to do this. They passed the law in 2019, but it's just getting a little bit more noise now. We thought we better, broach that topic with all of you. It has had mixed results. I will tell you it's still what I'll refer to as a niche business. It's probably less than 5% of the marketplace. But what you're really doing is betting that the individual marketplace will outperform price-wise the group insurance marketplace. Uh, so state by state, that varies dramatically. Nebraska, historically, the individual market was higher cost than the group, but now in more recent years, with some of the rate increases on the group side, that's been a little bit more of a challenge. So, for instance, we looked at ICRAs from Blue Cross on all of our cases. Small amount of employers looked better, but there was a few. In the small market, it's a way that you can provide pre-tax dollars now to employees versus just giving them a higher pay rate to pay for that coverage. It was originally designed for industries with really high turnover, where they were more interested in providing a budgetable expense for employees than an actual support of a health insurance product. But it is controlled by a defined contribution. So think of it like your 403B program, where you're saying we're going to give everybody 3% of pay or whatever your number is. This is now a way the employer can say, if healthcare is going up at 9%, maybe we can only afford 5. So we'll give 5% more dollars to everybody. We're happy to kind of review that with you if that's in your thought process, but it is a newer product and there's been a lot of confusion around it. Again, let me just pause for a minute, see if anybody has questions. Maybe you've pursued ICRA already and have some commentary about it.
Yeah, I would just add to what Jim has said. The devil is certainly in the details sometimes. The groups we've placed, I have a couple of them that have found the ICRA to be an interesting concept for them, were groups that were already really paying a much higher premium already, and then perhaps got a rate increase that was unsustainable on top of that. I have one customer, as Jim mentioned, that has employees in various states, and so with the spread out nature of their workforce, it made a lot of sense for them in some of those states where the premiums came down considerably compared to here in Nebraska. And so for multi-situs groups like that, it may be a concept that makes some sense. But the other part of it is the nuance that comes into play a lot of times. In the individual marketplace, it seems to me that just looking at the products out there, they're oftentimes driving members into those narrow network concepts. So whereas the small group, mid-market, and large group markets for insurance offer those networks as a choice, there still is the option or the alternative of keeping a very broad network access to all the doctors and all the hospitals. Whereas in the individual plans, sometimes they're requiring a push into those narrower network or narrower panels of doctors and hospitals. So you have to be a little bit just cognizant of what is available within the product itself. And that's something that you're ultimately uh, putting your employees in charge of now, as opposed to controlling as the employer offering that benefit to your employees. You're turning over that decision ultimately to them to purchase whatever plan makes the most sense for them, just simply providing them with some dollars to make those decisions on their own. So it's not a bad concept, just just a little bit different way of of offering that benefit as an employer to your employees.
Thanks, Corey. Any questions? I'll keep moving here, and then certainly we'll allow those questions. But a little bit about the NAM benefit connection, and I wanted to just give you that quick history. We developed it back in 2003. It was really designed for a program that would be stable and low cost for you. So the goals that were established back in 2003 remain the goals. I think we've accomplished this in a lot of ways, but it is the largest pooled medical program for nonprofits. Uh, Part of our large group advisory services are built into this. We spend literally, if it's not daily, certainly every week of the year, we're involved with the program, monitoring claims, looking at ways that we can raise the bar, provide either additional coverages or additional ways to finance that. We really have had a history of delivering low renewals and savings. So there's been a lot of nonprofits that have participated. Uh, as I mentioned, this year we had an 8% rate increase. Last year we were right around 6%. The year before that, 5%. So we have outperformed the marketplace in a big way. And I'll make this comment. I think sometimes we get questions, if we go to market this year, can we get a better price than the NAM program? And I'll always promise you, in a 1 year time frame, a carrier may have more of an aggressive stance and may go after some business, and there's some valid reasons why they do that. But if you look at it over any 3 year time frame, I would tell you, I don't think there's a better way to buy health insurance. You're part of a much larger program. When we negotiate, in this case with Blue Cross, we're looking at 8,500 people and negotiating the cost of services and the type of services for all of you to benefit from that 8,500. Consistency with benefit plans. So rarely do we make plan changes. We did make a few this year. We think that they made sense, but they're stronger plans than you generally can buy in the marketplace. We offer HRAs and high deductible health plans with HSAs. Blue Cross is arguably the strongest market carrier in Nebraska, and they certainly have the largest network. So providers in all 50 states. When we look at financial options to lower cost and maximize savings, for instance, when we delivered the 8% increase this year, all of the level funded groups were getting that. Those that had better claims experience get a refund of some of their premiums. And every year, anywhere from 20 to 30% of the groups get some sort of refund from that. And that's what level funding can do for you. We do have a number of larger nonprofits that take advantage of this self-funded program. So we're buying reinsurance levels, at 50,000, 100,000, and that reduces some of the fixed costs. expenses. So self-funding is a great way to go if you're large enough to reduce expenses. We've added technology, so we offer benefit admin systems for open enrollment. We do get our renewals earlier in the year, so we're delivering that news. Some of our traditional Blue Cross business and United Healthcare and Medica business all had a late session with the insurance department this year. So renewals were out much later. It made decisions a little bit more difficult, but we try very hard to make sure we're delivering to all of you those benefits. And again, truly, it's programs for you. We ask for a lot of input from you as we're looking at plan designs. Ultimately, do we know which group's going to get sick and which one's going to have a good year? No. There is a typical business cycle. And I would tell you that if you look at your own group, out of 3 years, there's 1 year that's always going to be a blow up year. You're going to have a bad claims year. 2 years, we hope you run better to help offset that bad year. But we never know where that cycle is. And that's one of the reasons pooling with other employers makes all the sense in the world. If you're out there on your own, you're facing renewals based on your own rate increases, that can be tough. It can be scary this time of year when you're waiting to hear what is the renewal going to be and how do I fit that into my budget. A lot of our customers will ask us, July, August, what do you think? How's things looking? And we'll try to provide some pretty good sound estimates for you to budget with. But we hope you find that whether you're in the NAM program or not, that our support of NAM itself and the programs that they offer to all of you have been meaningful. And that is unique about our agency. I didn't want to go into a ton of detail, but Matt, I appreciate the kind words. We really believe in the missions. We've learned a lot from all of you and want to continue to help subsidize and promote the programs that NAM has. It's been very successful. We've seen NAM grow now to over 800 members. So that's awesome. But many of you will know we want to hear the challenges. We want to be open with you. Healthcare costs are tough to manage. There are some ways that we can help figure that out for you, and we'll certainly bring those to the table. Let me stop there. Corey, do you have any final thoughts for them? And then we'll take some final questions.
There's been a couple of just direct messages to me in the chat about group size requirements and some of those things. So I can address that with the FNIC NAM program. The carrier does require 5 enrolled employees to offer a proposal through that. And so there is some underwriting that goes into that concept for the groups. So for those of you who may be smaller than that, as Jim and I discussed, the ICRA concept may be something that would be a really good fit for those smaller groups that are individual policies. There is small group still. There's the Affordable Care Act plans that are available. They're age-rated plans within the fully insured marketplace, but I understand that those are becoming tougher and tougher just because of where the rates continue to go, in that those age-rated products tend to be higher cost. But that ICRA concept could be an option for those of you with perhaps only 1 or 2 employees. It could simply be a solution of looking at the individual market. And again, that ICRA concept might be an opportunity for you to provide some tax advantage dollars to those folks that allowing them the opportunity to go out and buy their plans that make the most sense for the individual for their families. So there's not a great answer, unfortunately, in the really, really small market. But we try to tackle the small group starting at 5 lives through the NAM concept.
Fantastic. Thank you both. That's wonderful. There is one other question that I saw, which was, can the ER contributions be different for family coverage versus individual coverage?
Yeah, a lot of the strategies we get into is how does the employer share premiums with the employees? You can do it by class. So sometimes we see salaried versus hourly, but certainly there's differences in how employers are supporting the single employee. I will tell you on average, the employer's covering about 80% of single. And then family will be anywhere from 50% up to 80% as well, depending on each organization. And we see that kind of nationally bearing out. In some cases, the insurance carriers will require that you pay at least 50% of the single rate, and you're not required to pay any of the dependents. So by rule, you don't have to cover spouses, and you don't have to pay any portion of their coverage, but most employers have found a way to help those family rates as well.
Fantastic. Thank you for that. Other questions? Any other more discussion people would like to have?
If we're interested in pursuing this, who's our contact? Is that Jim or Corey or Matt? How do we start that conversation?
All three, you can reach out. We have a much larger team here, so it's not just Corey and I, but if you reach out to either one of us, we'll work together with our team to make sure we can help you out. Matt has our contact information, so
I can put it out in the chat too.
okay.
Yeah, that's great. But yeah, certainly we're happy always to be a conduit to FNIC too as well. So if you ever want to reach out to me, I'm happy to pass it along.
Yeah, we appreciate the support. Thank you.
Well, thanks for putting that in there, Corey. So yeah, I just want to say among the benefits that I think NAM membership offers, I'd point out the retirement plan and the financial services that we provide for small to medium nonprofits, that sort of thing. And along with those, this healthcare relationship with FNIC is really one of the great benefits I think that we have that really has the opportunity to be really meaningful, I think, for a lot of nonprofits on certainly an issue that's challenging and gets to be, it seems like, more challenging all the time. I'll say just from my personal experience, I'm dealing with a parent who's on Social Security and getting the Medicare premium increases for 2026 is a shock. Even though the benefit goes up 2.8 for a COLA for next year, the increases in the Medicare premium is not within that 2.8 boundary. Let me say, the benefit is going down in our situation, not up for next year. So it's challenging all around, I know. And I really appreciate, again, the partnership that FNIC has with NAM to make health insurance as affordable and as well fit as possible in these challenging times.
Yeah, Matt, one last comment I would just say is we do also have a program for the dental, vision, life, disability. We didn't want to go into that today just from a timing perspective, but we know there's challenges. We know you're stressed out over these costs. At least, if nothing else, we can be a sounding board for you. Even if you're working with another broker, we're certainly happy to give you our thoughts and input as you're navigating those healthcare costs. But we work with several thousand employers in addition to NAM, and I think we can give you a really broad perspective from small, medium, large businesses, what they're doing to help control that. And we continue to look at the NAM pool and encourage everybody to get their checkups. I think that's one way to stay healthy and limit your out-of-pocket costs. So thank you again.
All right. Thank you. Any other final questions or thoughts for FNIC? It's a great opportunity to have them here today to talk about this. So, all right. Well, with that, I will at least let Corey and Jim have the rest of their day back if they want. Again, thank you so much. I'm going to stop